My name is Michelle Bloom. I'm one of the certified nurse injectors here at CAPS, and I am going to be doing a live Botox treatment. So I have the beautiful Amanda. She has had Botox before, so she's not completely new to it. So we're going to kind of go through what that all entails. Now, those of you that are tuning in, you may know a lot about Botox. You may know nothing about Botox. So I'm going to kind of go over a couple things before we get started. So Botox is used to relax the muscle to prevent a wrinkle from forming. So, for example, like on Amanda, one of her trouble areas or areas that she wants to prevent any sort of like wrinkles from happening is the glabella area. And that's when you make your mad face. Make your mad face. Thank you. And then there's the surprise face. Yep. And we have those forehead muscles that we worry about, getting those creases there. And then the crow's feet. So that's when you, smile real big, and we worry about, squinting in the summertime in the sun and how we can prevent those from forming. So 3 main areas. Certainly we can do like a lip flip. We can do the bunny lines, which are like by the nose, like when you scrunch your nose up. And then the chin area, and even the masseters, which are the muscles from clenching. When that muscle relaxes with Botox, you can't move it. So then that wrinkle goes away. So that's why people like it. It takes about 2 to 10 days, up to 2 weeks to take full effect. So by that time, you'll know how it's going. And then it lasts about 3 months. So yeah, you ready to get started? Yeah. Okay. So we're gonna do the 3 main areas for Amanda today. So the glabella muscle, the frontalis muscle, and the crow's feet. A couple little things you should know about coming into your treatment for the day is if you're ever concerned about these forehead wrinkles only, I'll explain. This muscle actually relaxes down, but the glabella muscle relaxes up. So we usually do them together. So it's a kind of good thing to prepare yourself to know that we likely will be doing those areas both together to help offset each other and support each other. So yeah, so we'll do those 2 and the crow's feet. All right, let me grab everything. While I'm getting everything set up, I do want to tell you all that since you're logged in tonight, if you are new to Botox, you can actually get $50 off your first treatment here with us at CAPS. If you schedule within this first week with one of the certified nurse injectors. It's Michelle, and there's another nurse injector. Her name's Erin. So either of us this week. As long as you call in, you don't have to have your treatment this week, but as long as you get scheduled this week. All right. Rest back. Just going to clean the area with a little bit of alcohol. And if you have any questions, please feel free to leave us a question. We will do our best to answer all of them. Good. All right. Okay, so I'm going to be turned towards me. Okay, just a little bit. Yep, you can rest your head back. Okay. Perfect. Make your mat face for me. Good. So it's very simple. It's fast. It does not take too long, and I'll let Amanda sort of describe what it feels like when we're all done. So. How's that?
Not too bad.
Good.
It's always a little pinchy, but it's over pretty quickly.
Good. All right, those of you tuning in, we're doing Botox Live with Amanda and Michelle. All right, so go ahead and rest back again. You can let your, if you want to see how she moves this muscle, yeah, good. Keep it up high, perfect. You can rest a little bit. some of the post-treatment instructions for after having your Botox is just making sure that you don't rub or touch or press this area too much for the first like 4 hours. It takes Botox 2 hours to fully bind to the muscle. So we just want to make sure it's not moving at all.
Gotcha.
And then you want to avoid vigorous exercise for 4 hours right after treatment, and try not to lay flat for 4 hours after treatment. So yeah, all right, we're gonna do crow's feet.
And what about bruising? I don't usually bruise, but sometimes.
Yes, good question. So if you take anything like ibuprofen or an aspirin or anything that's going to thin your blood a little bit, it can put you at risk for a bruise. There is minimal bruising with Botox. Oh, you drove a hair around.
Yeah, thank you.
There we go. There we go. So bruising is minimum with Botox. Sometimes people will notice a little bit more with like fillers because those deeper injections. But certainly you can apply ice to the area if you need it. Not many people feel the need to. Or we have some great products that help decrease that bruising. All right, we're gonna do crow's feet area. Smile real big. Just want to make sure we're not forgetting Instagram over there. Little poke.
While Michelle is doing her crow's feet, for you guys tuning in tonight, we do have a special offer. If you are new to Botox at Caps and you book this week, you will receive $50 off your treatment. So make sure that you guys definitely get scheduled. You can either jump online at columbusplasticsurgery.com and you can actually book your treatment online, or you can give our office a call at 614-246-6900. And again, that's $50 off your first Botox treatment with Michelle or Erin.
All right, looking fabulous.
Yes.
So you can notice that immediately after having injection, it just sort of looks like little mosquito bites. It's just a tiny, tiny bit of redness. Otherwise, in an hour, that'll go away. This is a great lunchtime treatment. People will come in on their lunch break, leave, go back to work. If you're working from home, easy to get away at any time. We can do it quickly. So, yeah. Any other questions for you? Yeah.
If you guys have any questions, feel free to submit them. We'll make sure that Michelle gets them answered before we tune off of here.
Yeah.
Oh, we do have one. How do you know how many units you need?
Great question. So Amanda, I've known her for a long time, and we have talked before about what her treatment goals are and what areas that bother her. So with that being said, we can figure out the appropriate dose. I'll give you some rough estimates about dosing. So typical dose for this like glabella area right there is anywhere from 16 to 20 units. Forehead can be anywhere from about 10 to 14 units. And then crow's feet can be anywhere from about 18 to 24 units. So yeah, and then depending on the area, if you want some prejuvenation, which is you don't really have a wrinkle yet, but you want to prevent that from happening, doses might be a little bit, lower on that end.
Gotcha.
But if you're new to Botox and you really want to enhance everything, we'll figure out the perfect dose for you with a consultation, which we do those for free. Yep, so you can always come in for a free consultation with us.
It doesn't look like we have any more questions.
Yeah, no problem.
So
Yeah, you can always leave questions for us and we'll get back to you, or you can stop in for a consultation with one of us and we will be happy to answer all those as well.
Wonderful.
Well, thanks.
Thank you guys.
Thanks, Michelle.